Okay, good evening all. A pleasant good evening to everyone. And I thank you for sharing your invaluable time with us this evening. The 3 hours are going to run by so fast, so I hope you have your questions ready to put it in the Q&A. And we're very pleased today to have with us some incredible talent, scientific expertise, psychological expertise, and our moderator, Mr. Liben, Gebremikael, the Executive Director of Taboo, will introduce them and be moderating for the evening. And we have a very special guest in Mayor John Tory, who has come to bring greetings on behalf of the City of Toronto. Before beginning, I think it's very important, of course, to set the context, do the land acknowledgement. And for me, the land acknowledgement is a baby step in the co-creation of a new corporate work culture period in new levels of respect for the indigenous people of this country. We are on the grounds of Takaranto, the traditional territory of Mississaugas, Iroquois, Anishinaabe, and Chippewa. Treaty 13 and Williams Treaty both include Toronto. And in the very wise words of Justice Marie Sinclair, who said, and I quote, "We owe it to each other to build a Canada based on our shared future, a future of healing and trust." And through the efforts of this task force and these town hall meetings, we hope to contribute to that future of healing and trust. So with that, I want to welcome Mayor John Tory, and I turn the floor to you, sir.
Well, Doctor, thank you very much, and good afternoon to one and all, and thank you very much for attending, and thank you to the panelists in particular for the expertise. When Dr. Khenti made reference to scientific expertise and talent, he was not referring to the mayor. I understood that without any hesitation whatsoever. But you know, these sessions are part of a much broader program, and this one in particular fits into something else that starts today, which is Black Mental Health Week. And I'll just address both of those very briefly, because I know you're on to hearing from the experts and asking your questions. We decided early on as a city, first of all, right back at the very beginning when we knew we were in the midst of something extraordinary, that we would make sure that Toronto tried to set the standard when it came to looking after specific communities that were harder hit by COVID-19. And I think we haven't achieved perfection at that, but I think we've done a job that we can be proud of in the context of different plans we've had for seniors and for other people who were very hard hit. There is no question but that our Black communities in Toronto have been especially hard hit in a way disproportionate way to the share of the population they represent. So I think it's about 9% of the population, but it's been a huge percentage. I think somewhere up in the neighborhood of 20% of all the cases of COVID-19, perhaps even higher. I'm just going from memory. And so we put in place a Black Equity Action Plan, and we also put in place a vaccine equity plan. And that was accompanied by a roundtable of Black scientists that would help us with making sure that there was equitable access to the vaccine, but that also we addressed issues of vaccine hesitancy. And I was saying to Dr. Khenti before we came on here today that when it came to the seminars on vaccine hesitancy, I was unaware of the history. I studied history in school, but you know, there's so many things you did not learn in the context of Canadian history or history generally. So I went and read up about vaccine hesitancy, and I certainly understood when I'd done just the smallest amount of reading why there would be hesitation to just readily accept something the medical establishment said was the case when you take into account treatments not administered to Black people in the past for infectious diseases, cells harvested from people without their consent to do experimentation and this kind of thing. I could see why that would produce an extremely hesitant, if not worse, attitude about medical science and about the medical establishment. And so that being as it is, we have to try and address that here and make sure people can feel confidence in getting vaccinated, which is what we want. And so a number of things have been, a number of seminars have been held. I attended the one on Saturday that had to do with vaccine hesitancy per se, and today's has more to do with the mental health impact of COVID-19. And you know, and I know that in the entire community, the entirety of Toronto, the public health restrictions, the threat of the virus, the disproportionate effect it's had on the Black communities in Toronto have created huge problems beyond what we normally experience. And I said at the press conference today that, you know, it's scandalous really the amount of access to treatment that is not available to all people in Toronto. But of course, that becomes worse when you deal with the Black communities. And so this is an attempt to try and address some of those concerns that you have, and to have you have made available to the very best experts that we could find, who could talk to you about mental health and COVID-19. And we've tried as a city to put some very special resources in place, including this, but going back to our 211 service, where we had mental health professionals who were able to do culturally sensitive advice to people and comfort and support to people from a whole bunch of different groups, including our Black communities. And so I just want to say again, thank you to those who are helping put on this session today, to say that I did officially proclaim today as the first day of Black Mental Health Week. And I also said today that I understand why, people ask me, well, why would you have a Black Mental Health Week? And I said, well, if you take the prevalence of mental health that exists in all of the community of the city that we call home, all of us, and you add to that some of the incredible anxiety and stress that can be created by acts of racism that you experience, anxiety about your kids and what they're experiencing at school by way of discrimination, or even just the notion, which I've learned about again. And you may say, well, it's about time you learn, but again, you're never too old to learn, and I've tried hard. But even just the anxiety and the stress that can be created by something as simple that I can't even imagine as going out for a walk, or going into a store, or going for a drive, and having to worry about how you'll be treated on any of those kinds of routine outings that I would treat them as such because of the color of your skin. And so that can cause the kind of stress that can, exacerbate and make worse anxieties and stresses that people have. So I wish you well in this seminar today. I thank you for giving me this chance to speak. And I will just say, because he's part of this, and I paid tribute to Taibu and to Liben before, but just say thank goodness for Taibu. And they were said in the previous session we were on today that we wish we had 6 of them, and we'll work at that. But for now, we have one very special one and a very special leader and team. And I thank them for their part in pulling all this together as well. And good luck with the webinar. I'll listen to it as much as I can, but I have to go off to do a radio program towards the bottom of the hour. So thank you so much.
Yeah, your comments reminded me of a book, Black Like Me by John Howard Griffin. And, the one thing the one takeaway from that book was when he himself looked in the mirror after he had, done all the things with himself, and he looked black and he saw a Black guy. One of the revelations was that he was shocked, even looking at himself, that he didn't have the empathy for this Black figure in the mirror. Oh yeah, it's tough. So I've always started these town halls by not just doing the land acknowledgements, but paying acknowledgements to ancestors whose struggles and sacrifices make me possible, make the work I do possible. And as we're talking about Black Mental Health Week, I'm reminded of National Negro History Week, National Negro Health Week. This lasted from 1915 to 1951 and was launched by Booker T. Washington back in 1915. And what Booker T. Washington said in 1915 surprisingly applies today. He said, and I quote, "Without health, and until we reduce the high death rate, it will be impossible for us to have permanent success, whether in business, in property getting, in acquiring an education, in achieving scientific progress. No field of endeavor will be in our purview." That's Booker T. Washington in 1915. He could have well be speaking of 2021. It was only in December 2020, only 2 months ago, that we saw some very disconcerting statistics. Blacks and racialized communities, which were socioeconomically vulnerable, were acquiring some of the highest rates of testing positivity and hospitalizations in the city. These were accompanied by low rates of testing, as well as high rates of vaccine hesitancy. The vulnerability was stark and striking. The marriage of hesitancy and high positivity seemed to be long-lasting and problematic. We weren't even sure about death rates or mortality. And so there was no option but to take action to address this problem. But it's a public health problem. My screen is frozen. Okay. Yeah, so we realized that what was looming was a public health disaster for Black communities. And this is a realization brought home to many communities across North and South America, as well as Western Europe, the UK, France, that Black minorities are disproportionately affected by the pandemic. Our hospitalization rates are higher and our mortality rates are higher. What makes it a public health disaster isn't just the loss of life, the loss of health, but also the potential for these problems to persist. You know, 20 years after SARS, according to the British Medical Journal, people were still experiencing post-traumatic stress syndrome who had been frontline providers during SARS. People were experiencing depression and a higher rate of suicide if they had been involved in SARS. So it's not just a public health disaster unfolding now, it's a potential public health disaster down the line.
Akwatu, do you mind doing it like the slideshow? So it's.
Yeah, I don't know why it's not.
No, not from beginning, from current slide.
Is that good?
Thank you.
No, thank you, sir. Yeah, so we're experiencing a public health crisis, and this public health crisis has been compounded by the economic impact of the disaster. Lost jobs, lost income, lost equity, lost savings, and in some cases, lost housings. Many racialized individuals, especially Black people, are facing evictions and facing homelessness. And so the ranks of the homeless are becoming increasingly racialized. It doesn't bode well for the future of a Black community that went into COVID experiencing significant inequities across the socioeconomic continuum. Along with that, of course, are the mental health implications, the mental health consequences that shouldn't be a surprise to anyone. We had a loneliness epidemic going into COVID, and that loneliness epidemic is sure to be exacerbated by the social distancing that's required to address the pandemic. We had other risks, anxiety risks, sure to be exacerbated by the educational challenges we face and are sure to face coming out of the pandemic. And of course, those of us with depression, those of us who had anxiety problems, those of us who had substance abuse issues going into the pandemic, many of us are seeing our health problems amplify and magnify. And it doesn't bode well if we don't address it now. Now we know what's required in terms of COVID-19, use of masks, practice social distancing, frequent hand washing, getting vaccinated. But what about the mental health problems that are being amplified due to COVID? What can we do? Well, there's some things that are relatively straightforward, simple, just like hand washing, staying connected, staying active, learning something new, becoming mindful and appreciative of small things every single day that we get through this pandemic. But you may have more complex questions that need expert advice. And so we've brought together a panel today in the hope that we can provide you with some guidance, some support, and some direction, especially if you are having anxieties around getting vaccinated. You're getting mixed messages from social media. You're wondering, how do I make this decision? How do I make the best decision for myself and for my family? Our hope today is to be able to support you in that decision making. So with that, I'll turn it over to Liben Gebremikael to take us through the evening.
So the famous you're muted phrase of 2020, I was muted when I started speaking. Thank you very much, Akwatu, for that context setting. And thank you, Mayor Tory, again, for setting the context for us, giving your personal reflection on the issue of COVID-19 vaccination and mental health today being the start of the Black Mental Health Week. So we really do appreciate. And so we have a lot to talk about. I know, as Dr. Khenti or Akwatu just said, COVID is, for me, COVID is just like an X-ray. It is really telling us what has been existing for generations around the challenges and the barriers and the disparities that the Black community has been facing. And then with the advent of COVID, really amplified the challenges that we face. So, so that is why we're having this conversation, including vaccine hesitancy. And earlier on, we had a great discussion, and another leader among ourselves, Dr. Camille Orridge, says we shouldn't be talking about vaccine hesitancy. We should be talking about Black communities trusting the system so that they are ready and comfortable to access the services or to take up services. So that is the conversation that we're having. And today, particularly, how COVID has been impacting the Black community. So we have a great panel, as you know. I will start with beauty this time around and not age. So Akwatu, I don't think you will be too against me, but first I really would like to acknowledge the presence of Dr. Justine Joseph, who is a licensed clinical and forensic correctional psychologist. Her research areas include multicultural issues in psychological assessment and treatment, and pathways to mental health care for immigrant, refugees, and ethno-racial communities in Canada. Dr. Joseph's consultation activities center around mental health capacity building in local and global context and addressing racism as a public health priority. I think particularly, immigrant, refugees, and other ethno-racial communities within the diverse Black communities sometimes are also not considered properly. So I think not only her presence, but her contribution will be very helpful for us to understand the different intersectionalities of our rich and diverse communities. And then I also have the pleasure of introducing a good colleague and friend of me personally, but of Taibu, Dr. Natasha Williams, a registered psychologist and the clinical director of Allied Psychological Services, which is an anti-oppressive, multi-ethnic, multilingual psychological private practice providing a variety of services, including assessment, psychotherapy, corporate consultation, supervision, and training to clients from diverse backgrounds. Dr. Williams is an international professional speaker, trainer, published author, and the president of the Association of Black Psychologists. And I don't know why she doesn't put it in her bio, but I know she's one of the Black mental health professional who has played a significant role in the work of the adaptation of the cognitive behavioral therapy, the CBT therapy for African Canadians. And that is significant because that is how we can then bring resources to our communities. So she has played a significant role in doing that. And she also trains Black professionals so that they can utilize the adopted CBT for African Caribbean communities. And last but not least, of course, my good brother, whom you've heard already, Dr. Akwatu Khenti, who is the special advisor to the City of Toronto's COVID-19 Equity Initiatives and chair of the Black Scientist Task Force on Vaccine Equity. He's an affiliate scientist with the Institute for Mental Health Policy Research at the Center of Addiction and Mental Health, CAMH, and an assistant professor with the Dalalana School of Health. He's also the former Assistant Deputy Minister for Ontario's Anti-Racism Directorate, where he's done a lot of work, including the development of race-based data standardization, as well as CAMH Director of Transformative Global Health. We have worked with Dr. Khenti and CAMH in doing the stigma project, addressing stigma within the Black community. So that's also another initiative. He has a PhD in health policy and Equity from York University. So I can attest that we have the right people with the right knowledge and the right experience and great passion for us to be addressing our concerns, our questions, and also giving us, good education around Black mental health and COVID-19 as well. So I am very thrilled to welcome you as a panel. And as per our program now, we will start having consideration about some of the questions that have already been gathered from our communities members. And for our participants, if you would like to have your questions answered, please start putting them in the Q&A, and our tech people who are behind us, Aika and VJ, will be, bringing your questions to the panel so that we can address your concerns. So let me start. I started the introduction of the panelists by introducing you to Dr. Justine Joseph and Dr. Natasha Williams. Let me start with the first question to Dr. Khenti. So the first question is, which is making people more anxious? The virus or the hysteria in the media?
I don't think it's, I think it's the virus. I think testing positive is a key source of anxiety. But I think what really is creating the most anxiety are the job losses, the savings that's being expended, the loss of home, the potential loss of home, the facing evictions, the inability to get sick days. That's a lot of anxiety. And that's one of the reasons why some people hesitate to get tested, because they get tested and they have to take off 2 weeks. Who's going to pay the bills? So paying the bills really, the socioeconomic setbacks that people are experiencing are significant, but it's being amplified by social media. We have to social distance. There's not much we can do. We can't go to clubs, we can't go dancing, we can't even go to the park, the dog park. You gotta wear a mask to go to the dog park. So what do? You spend a lot of time on social media, and when you spend time on social media, you see regurgitated the same news, and that actually helps to, or I should say it hurts, because it amplifies fears, amplifies a sense that worse is coming, and it actually impinges on hope, I would say. So it's a sort of a mix, but definitely the socioeconomic factors are driving the anxieties up. One more point before I turn it over to you. If you had pre-existing anxiety, pre-existing obsessive-compulsive disorder, you are more likely to experience greater symptoms during the pandemic.
Thank you, Akwatu. And I think the social media is where there is an unbalanced view of information, and that should be balanced with accurate information to balance the concerns with answer and question, to the questions or concerns that people have. And that's probably what you were saying, when people are spending too much time on social media, that reinforces the concerns and anxieties without having something to demystify or provide accurate information. But you talked about existing conditions, and if I could come to you, Dr. Natasha Williams, what if I'm already living with an anxiety disorder, and with media coverage now telling me all these concerns that are out there, or high positivity rate, whether it could be in my neighborhood, how can I really cope, or how can I best cope with this? Because I think there's a degree of what is in your control. So if you could just respond to that question.
Sure, thank you. what's very interesting is that we also have to get a sense and understanding of if this individual or individuals have had pre-existing anxiety disorders, we would then have to understand how were they initially coping with those pre-existing anxiety disorders if they were diagnosed accurately. So we would have to get a baseline in regards to how the individual was coping or dealing, or maybe not, with those pre-existing. So did they already have a baseline of, you know, therapy, of medication, of social networks? What was it that they were doing previously before the beginning of this pandemic and everything that has come about as a result of it? So that's the first thing we would want to look at, because if the baseline was already not strong, if there was pre-existing concerns that were not being addressed, or were not being addressed accurately. So for example, if the person was also then layered with a substance disorder as well, or abusing substances to help initially cope with the anxiety, then that pre-existing and that baseline is going to make it then extremely difficult to then look at how do they then cope currently. So that's the first thing. Yes, now we're also now talking about the amplification of these pre-existing conditions because of the increase of uncertainty. A lot of times anxiety is fueled by uncertainty. I don't know what is going to happen next. Things are coming, information is coming at such a feverish rate, but also on top of that, it's also the source of the information. Where is this information coming from? A lot of times when we're looking at our social media feeds and those kinds of things, the information is coming from questionable sources, which can then amplify the feelings or the uncertainty of anxiety. So what I would recommend first and foremost is when we're talking about social media and anxiety is how do we then mitigate or reduce the amount of time that is being spent on social media. A lot of times what I would tell people is that if you're starting your day on social media, that already sets the tone for your day. So in terms of just one of the first ways to begin to cope is to then, how do we monitor our social media feed and making sure that the information that we are ingesting, because I would not say not to receive information, but we have to ensure that the information is coming from credible sources. The second thing as well, which I also believe fuels the anxiety, is the uncertainty. And how do we then look at what are some of the things or items that that we can be more sure of, if we want to speak to it that way, because a lot of times we look at the certain things that we're not certain of and we amplify them to such an extent that it ends up being overwhelming. What are some of the things that I can control right now? And that will, I would say, mitigate or reduce the intensity of anxiety. It doesn't go away. That's the other thing. The anxiety is very real. We are in a situation where anxiety is going to be prevalent. So it's not about eliminating the anxiety, but what are some of the things that we can do so that we can reduce the intensity of the anxiety so it's not overwhelming.
So managing better the condition that we have. Are there any kind of things that people can do? I mean, we know that there are certain, exercises or breathing exercises that people can do if it is very intense at the moment.
Yes.
Is that the same thing? Are there other things that people can do in order to at least cope with it at the time?
At the time, yes. So there are some strategies and techniques that, as psychologists, we would recommend for the management of anxiety in the moment. Sometimes we talk about things such as deep breathing and being able to train somebody through deep breathing techniques. Sometimes within a CBT framework, we would talk about box breathing. So what happens is being able to breathe up and down the sides of a box in a sense, so that that person is then taking deep breaths. Because what happens with anxiety is that there's a huge physiological response in connection with anxiety. So a lot of times the shallow breathing will then bring about other symptoms, including the accelerated heart rate, including the shaking and the nervousness and the sweaty palms. So being able to first and foremost be able to have a space where you're able to do some of that deep breathing is going to be beneficial. I would then add on to that, for a lot of us in our community, what we don't tend to do as much when we are anxious is to take a moment to actually meditate or pray. Being able to be in that practice is something, especially in our community, is something that is integral, but sometimes we forget that it's something that will be an assist for our own being able to work on our anxiety, being able to meditate, to pray, to be able to even allow ourselves that space to do so. Because for some individuals, what happens is that they feel in that anxiety, they don't believe that they can even find the space to do that, right? And to be able to, I even tell some of my clients, and especially a lot of women that are, feeling that they're being overwhelmed with the responsibilities of children and homeschooling and work and those kinds of things. I have a client who she basically locked herself in the bathroom. And I say that not necessarily as a joke, but it was for her to be able to afford herself and believe that she was afforded the opportunity to provide that space and to protect her space so that she can do some meditation and deep breathing, so that she can then be able to tackle the rest of her day. But giving herself the permission to take that time out was absolutely integral for her. The last thing that I would also mention would be mindfulness. And what's important with that is understanding being present in the moment. There is an African-centered principle that part of the Association of Black Psychologists we were trained on, and a lot of it is it's a tapping method. And as part of the mindfulness, what you would do is tap your heart center as you are, bringing yourself back to present. And in that tapping, it allows you to just, feel whatever it is that you need to feel, but also understand that, you are in this present moment, I'm sitting in a certain chair, or am I sitting on the floor? Where are my feet? So being able to tap your heart center, as well as being able to be grounded in that practice, is also, I think, a great way to start to mitigate some of that anxiety.
Thank you very much. That was very comprehensive and fulsome. And I'm hoping that people are taking note. Dr. Justine, if I could come to you, Dr. Justine Joseph, if I could come to you, and maybe, you may have additional comments and responses to what has been discussed so far, and maybe particularly with some of the clientele that you serve. But added to that, how can people emotionally support friends or family members or co-workers who may have been impacted by COVID, who may be quarantined? I'm sensing and I'm hearing from our communities that one of the challenges is that, if some, like we are used to, like, if somebody or a family member or a friend is not feeling well, we just get up, go, do what we need to do. And it's easy to do that. And it creates that, connectedness with people. And now it's a challenge because we have to do it, and we have to do it virtually. And I don't know, maybe if you have some ideas or suggestion, or also understanding how that impacts people.
Yes, of course. And I mean, I think we've started this conversation at a really great place, because before we can help anyone else, we have to do our best to bring ourselves to a place where we can actually give and help others. And so Dr. Khenti and Dr. Williams have really touched on some core principles, some core strategies for managing our stress. Each and every one of us has a certain capacity to deal with stress. Under normal circumstances, we have our routine go-to activities that help us to continually empty that bucket. In these times right now, those activities that we usually have access to, we really cannot use. And so we do have to turn to some new ideas, perhaps things that we haven't really considered before, to see, what can keep us maintain our sense of health. So Dr. Williams, she spoke about relaxation around deep breathing. I always tell my clients that breathing seems like such a simple technique, but it is really so powerful. I think most of us can appreciate how easy it is to feel stressed. And sometimes that stress can feel uncontrollable. I think what a lot of people don't appreciate is that in addition to how easily we can feel stress and feel the physiological effects, is also that we have these built-in innate mechanisms to help combat that stress. And so when we are doing our best to regularly practice these relaxation techniques, what we're doing is actually working to counter that stress on a physiological level. So to the extent that we can't be very stressed and very relaxed at the same time. So being able to implement these relaxation practices, ideally in a routine way, can really help to empty that sort of quote unquote bucket of stress and put us in a place where we have more room to cope with the day-to-day stressors, with the additional stresses of COVID, with the additional stressors of being lived experiences of being a person of color, living in marginalized communities, that we have that extra capacity to get through the day, and perhaps to also reach out to friends and families, coworkers who need our supports. Dr. Williams also touched on mindfulness practice and prayer. Finding these moments where we can connect with ourselves is really very self-nurturing. It's refreshing from a spiritual sense, can really sort of get us, help us to shift our mindset, especially when we are being inundated with so much information. By being present, by being able to appreciate the small things in life, being able to acknowledge that perhaps we're in a place where we're feeling stress, also sets us up for being in a position of power and feeling that we're in control of our destiny, in the sense that in being able to recognize and sit with some of these feelings that are at times distressing, that are at times uncomfortable, we are actually more likely to be able to navigate, to find a way through that, and to find meaning perhaps in those small things, maybe those things that we overlooked before, and perhaps even find a place where we can begin to thrive. And so all of these things are so important when we're thinking about this pandemic. I think many of us did not anticipate that, we were all looking forward to 2021 being a whole lot different. And right now we're dealing with a lot of the same. And so we have to think about ways that we can continue to move forward until as a society, we get to a place where we can go back to doing some of the activities that really that we typically look forward to and really sort of feed us and feed our spirit. That being said, we're in the here and now, and I think we're all trying to find ways to cope with the things that are being thrown at us. And for some of our friends and families who were more directly impacted by COVID-19, perhaps some of those individuals are being quarantined. We're also looking at ways that we can sort of help and how we can sort of band together as a community to get us through this really difficult time. So of course, if you are available to provide practical supports that can assist with daily living, like delivering groceries, medicine, personal care items, or if you know organizations or networks that can provide that support, make it known to the people in your circle who you think might be struggling. And I think it's important to note that even, we don't necessarily have to wait for individuals to reach out for help. For many of us, for various reasons, it's hard to ask for help, even under the best of circumstances. And so in my view, it's better to assume that perhaps people need some help, and that it's better that they know that you're available if you need them. Aside from practical supports, I think Dr. Khenti touched on loneliness and how, loneliness, especially in the context of this pandemic, really could be the seed of something that really amplifies psychological distress and perhaps some difficulties, mental health challenges down the road. To one degree, loneliness is normal. It's the way that our body signals that there's an unmet need. We're all social animals, and to different extents, we need to connect with people. Where things really become problematic is when that sense of loneliness becomes very acute, when we're suffering from chronic loneliness, and that's when things can transform into more of a clinical problem or issue. And so I think it's normal that we have that we seek this connection. And I think we have to assume that other people to some degree will benefit from this connection, even if they're not able to necessarily verbalize that in a forthright way. So don't hesitate to reach out to people who might be in quarantine, who might be maybe less on the scene or less present than you know them to be. We can do a variety of things. We all have various aspects of our lives that we're trying to juggle for ourselves, but if we could reach out in a supportive email, a letter, a care package, like a brief bite-sized conversation, 10 minutes, send a funny joke or tell someone about a song you enjoyed and suggest that they listen to it too. The smallest things that can really provide any sense of connection, they accumulate and they add up. So anything that we can do, any bit of us that we can share with our neighbors, with our family, with our community, is going to make a difference, even though it may seem that something really small can possibly help. In any given moment, that could be everything to the next person. So yeah, anything that you can do to stay connected while physically distancing is great. There's lots of well-established evidence for informal social supports. And of course, if you're noticing that people in your life perhaps are needing a bit more, there's a lot of emerging supports, community organizations like Taboo, other networks, psychological practices in our community that are coming forward with more resources that are really targeted to racialized populations than ever before. The online virtual or the increase of online services, the increased virtual presence of mental health practitioners of color, of other practitioners who are really dedicated to and anti-racism, anti-oppressive practices in their work are really coming to the forefront. For a long time, it's been difficult for people who are seeking care, for people of color who are seeking care, to find the right fit. I think this is really sort of the silver lining of COVID, is that it's afforded an opportunity for these practitioners, these safe spaces, to become much more visible, and for people to feel that it's okay to reach out.
And even, across geographical areas, I think one of the things that COVID has brought about is the possibility of connecting virtually and so accessing services where, we know that we already have a shortage of professionals who are, who look like the community, who reflect the community's lived experience. And now is an opportunity that maybe we can branch out and seek out people who may be able to provide that service. So that's also very important. If I could come back to you, Akwatu, and maybe, you started a conversation earlier on, and for us to really have the context of what do we mean by mental health? And that also speaks to the work that you have done for a long time around stigma, because I think there is a double stigma here. There is a stigma of COVID-19, as you said earlier on, because of employment situation or because of other reasons that people may not want to really get tested, or if they're tested, they're not seeking out services. But at the same time, mental health being a very big worded subject, what do we mean by mental health, and how has pandemic in general has impacted or affected communities' mental health? And you're probably on mute.
Always, I always on mute. Okay.
I know you're never short of words, because even if you're not listening to Akwatu responding quickly, that means he's on mute.
Okay. Yeah. So mental health problems affect the way we think about ourselves, relate to others, and interact with the world around us. It affects our thoughts, our feelings, and our behaviors. And what's important to sort of note about COVID is that COVID affects the way we think about ourselves. It affects the way we relate to each other, and it affects our behaviors because of the social distancing, the increased anxieties due to positivity, and just a range of socioeconomic challenges that we have to face. So there's an intersection of what would be traditional mental health concerns with COVID-related issues. And, you know, this is a sort of a practical way to think about why COVID poses so much risk to people, because it really interrupts our capacity to function mentally and be mentally well. What was the question? Second part of what was the second part of the question, if you don't mind?
But mental health is how would we define mental health? So when we say COVID is impacting our mental health, what are we really looking at? Because some people might think just in one way, and knowing that the term mental health is already a stigmatizing kind of concept.
Yeah. So, you know, everyone reacts differently to COVID. I mean, even though we have these sort of categories of responses, people's capacity to cope is different, and it varies by personality. We all have different social and economic circumstances. We all have different access to available local resources. And that impacts what the mental health consequences of COVID would be. Also, I think it's very important to note that during COVID, that it's normal to feel sad, it's normal to feel distressed, it's normal to be worried, it's normal to be confused, it's normal to be scared. It's even normal to be angry, given all that has happened within the past year, and how much we have lost. We haven't just lost economically, we haven't just lost the material things, we actually lost the ability to grieve the passing of our loved ones. I myself knew several people who passed away during the year, and I wonder when we get through COVID, if then I'll be able to grieve properly, or if by then, I might have compounded grief. I might have PTSD, who knows? Because sometimes it shows up 20 years after the emergency or the situation. So that's number one. And there are signs of severe emotional distress that one must pay attention to. Are you experiencing persistent insomnia? Are you experiencing significant interpersonal problems that you weren't before? Because, you know, not only are interpersonal problems being amplified, but in some cases it's leading to domestic abuse. Are you experiencing increased anxieties, fears of going outside, so that you're not able to go outside anymore? You're not able to do normal activities. Is your drug use, your alcohol intake surging? These are all signs that your reaction has gone beyond normal reactions to stress, normal reactions to trauma, and you need to get help. You need to get help, I need to get help, we need to get help. And the big issue for people in the Black communities, and I say Black communities, is the stigma that prevents many of us from help seeking until the problems become severe. One of the reasons we end up in emergency rooms or in interactions with police is because when it's mild to moderate symptoms or signs of distress, we feel we're weak to get help. We feel that it might be something spiritual, and we only seek spiritual advice when we can seek spiritual advice and along with health advice at the same time. They don't have to be dichotomous. So and finally, last point, as I touched on that question, is that we have a lot of resources that have been made available to us during this pandemic. And the big question is, will we use it? Will we use the telemedicine? That's free. You know, you can get counseling for free, and you could actually request culturally competent counseling. There's various other internet offerings that you could access. That's also free. But you know, if the internet or the telephone isn't good enough for you, call Taibu, call Stella's Place, call Black Creek, call Rexdale. There's a lot of community health centers that are offering supports to people in distress during this pandemic, and going as far as possible to make it as accessible as possible. And online, you have blackyouth.ca. You know, you could check them out. Bounce Back, Big White Wall. These are internet resources for people to access. And finally, if you think you hit a wall, call 211. Go to an emergency room. Talk to a friend. Get advice. Don't keep it in and try to solve it yourself. If you think you're at that peak, get help. In our communities, there's many stigma towards help seeking, and that's one of the things we have to overcome.
Thank you, Akwatu. As you were describing some of the challenges or the impact of pandemic in general on mental health, one of the things that you talked about was around loss and grief, and particularly within our communities. I think we're seeing some challenges with people going through that process. By itself, grief is a challenging process to go through, right? Losing a loved one is a challenge, and then compounded by the situation and environment that we find ourselves. So, Dr. Natasha, within the impact of COVID and pandemic on mental health, and particularly when somebody loses a loved one, what are some of the things that would be helpful to go through grief? Maybe like as we were saying earlier on, COVID just is on top of everything that we have been experiencing. So maybe you want to start there and then add COVID onto it so that people find ways of addressing that. Thank you.
And thank you for that, because I think what was also important that we had to discuss is that grief and loss, when it comes to death, is compounded by other losses. So what we're looking at is that, especially in the midst of COVID, we're talking about loss of stability, loss of job, that loss of financial stability, possibly as Dr. Khenti had mentioned, loss of housing, loss of social supports, so because of this, of the whole factor of social distancing. So what we're looking at is compounded grief. Right? So then now we add not only that we have our fellow brothers and sisters that are dying at insurmountable rates due to COVID-19 and maybe the inability to actually access adequate care, then we're also in a space that we're actually unable to grieve the way that we've known to grieve in regards to going to a funeral, being able to congregate with our loved ones, going to a wake afterwards, and being able to connect with friends and family to engage in that grief process. So this also increases the difficulty. So with a multi-layered issue, there's not going to be one stop solution. So I think, especially if we're adding the death of a loved one, it's to first of all understand that the grieving process is going to be different for everybody. I've seen where individuals will grieve by sitting, reminiscing about the individual, talking about the good times or the bad times that they've had with this individual. And that is part of their grief process as they are then able to move forward, and whatever that means to them. If it means, being able to wake up the next morning, attend to their children, being able to go to work if that job is available. So that's part of their grief process. Others have more difficulty where, again, they're not able to engage into it in that process in terms of how they have typically gone through their grief process. So what they do is they hold on to how things typically were, and then what that does, it exacerbates the negativity or the entrenched nature of the grief process. So what I would recommend in those circumstances is, how do we then connect? Because I think it is in the connectedness that we are then able to mitigate some of the intensity of the grief. We are now in a space again where we have to social distance. So I think in these times, we are looking at how do we utilize technology to be able to engage. And I talk about things such as computers, social media, being able to go through, Zoom chats, Google Hangouts, those kinds of things. And yes, that provides you with at least being able to see somebody visually. But I talk about things, if we're going to grassroots, nothing more than picking up the phone and being able to hear someone else's voice and being able to engage is actually another one of the ways that you would be able to start to engage in that grief process, but also understanding that that grief process is not going to be the same because of COVID-19, but we can pivot that grief process so we don't feel that we don't have the opportunity to grieve. A lot of times, because we're in this COVID-19 pandemic, we also feel that we're losing out on the opportunity to grieve, period, because we're not grieving the way that we would normally do so. So what's going to be important is we're able to still engage in a grief process, which will look different for everybody, but also that grief process will be different for everyone. So what we also want to look at is, how do we then engage and stay connected? The isolation will actually entrench some of that grief process. Liben, you're on mute.
Sorry. Thank you. Any additional comments, Dr. Justine Joseph, around that before we go on to break? We've learned today that we have to look after ourselves and being on Zoom for a long time. So we're going to take a short break, but I just wanted to ask Dr. Justine Joseph if there was anything you wanted to add to the comment that Dr. Williams provided.
I only a quick comment to really again emphasize the importance of social connection that Dr. Williams was discussing and really trying to highlight, and that in these times we do need to do our best to be willing to be open to new way of doing things, and sometimes it's easy to get stuck in a mindset that, well, if I can't do things the way that I'm used to doing them, then what's the point of trying anything else? But I think that can be a frame of mind that might only lead to more mental health challenges down the road. And I would encourage people to sort of look at maybe new approaches to doing aspects of their life as a bit of an experiment. Try it out and see how it goes. The outcome might surprise you in a positive way.
Thank you. So to give people some time just to stretch, if we can come back at 6:10, and there is a surprise panelist that we want to introduce to you, and it's going to be in a different way. We should have introduced this panelist at the beginning, but I missed that opportunity. So I'm being creative, and I'm going to introduce an additional panelist to give them some additional information when we come back. So if we could take a break and don't log out, please. Just put your camera off or just put yourself on mute, and then we'll come back at 6:10. It's now 6:03, so we'll come back at 6:10 to continue the conversation, so people have time to stretch, walk around, grab something to drink, and come back in about 7 minutes. Thank you.
There are more mental health problems.
Okay, it's 6:10. I think we can get ready to come back on. I'm hoping we are back. So as I was saying earlier on, we have a surprise panelist to present to you, and he could not be with us this evening, but we have his comments, his wisdom, and his voice with us. It's Dr. Quan Mckenzie. Dr. Quan Mckenzie is the CEO of Wellesley Institute. He's also a professor of psychiatry at the University of Toronto. He is also the director of health equity at CAMH, very well-known community researcher, so he's also part of the Black Scientist Task Force on COVID-19 vaccine. And so I will ask our important tech staff to help us share his message right now, and I'll unmute myself.
There are more mental health problems during COVID-19, and some people have gone as far as saying that there's another epidemic, another pandemic that's happening, which is a mental health pandemic. And there are at least 4 reasons. People who get COVID-19, well, they actually have an increased rate of anxiety and depression. Another reason is the public health measures. Some people find them stressful. And on top of that, during lockdowns, we've seen increased rates of domestic abuse and increased rates of substance abuse. Then we've got the problem with people getting services. So some people with existing mental health problems have had difficulty getting treatment because the services have not been available. And we've seen more people have relapses of their existing mental health problems. But then the last reason is the economic impacts. So financial insecurity and worries, well, they're linked to increased rates of depression and anxiety.
Thank you. Thank you. I think that was an important information to add to our conversation. And so let's get back to our conversation, and please put your questions into the Q&A and we will bring them to the panelists. I've seen quite an interesting interesting questions put in there, so please continue to put them. And once we have our registrants' questions addressed, we will come to your questions. So now we ended up our previous conversation by talking about how to deal with grief and loss, and thank you for those insights. If I could come back, I think one thing that we touched upon, and maybe we can expand a bit on that conversation, is with regard to existing conditions that we have, and then how do we deal with, and this particularly with regard to washing hands. One question that was, how do I balance washing my hands enough and not becoming obsessive about it? So if I could pose that question to Dr. Natasha first, and then I'll come to Dr. Justine Joseph.
So I think, thank you for that question, Liben. I think where the balance lies with that is we want to look at the balance becomes, how is the hand washing possibly impacting day-to-day activity? So as an example, we are being told through this COVID-19 pandemic that obviously hygiene is of the utmost importance. You want to make sure that you regularly wash your hands, make sure that, that we're engaging in that routine. Where we start to look at it, where it's looking more of an anxiety disorder, like an obsessive compulsion, is that hand washing negatively impacting day-to-day activities? So for example, am I unable to attend to my activities of daily living because I am so entrenched in hand washing that I cannot engage in daily day-to-day activities? I am not able to, engage in my social or recreational activities. I'm unable to go to work because that routine is so entrenched that I'm unable to engage in those activities. So when we start to look at how these activities are then impacting things that we are wanting to engage in. So another example would be, is the hand washing impacting our ability to engage socially, safely, of course, but I need to wash my hands because I am not, and I will not be able to engage, on a social platform or be able to, touch the computer or anything of that nature. How is it impacting our day-to-day activities? And if it is negatively impacting those things, then we have to really take a look at it in terms of what professional help would need to be sought for that, because of how it is impacting ADLs, social, recreational, occupational types of activities.
Thank you. Dr. Joseph?
In addition to Dr. Williams' comments, I would add that, I think we've talked a bit about mindfulness and trying to be more present in the moment. And some of those moments are definitely uncomfortable, and our exposure to media, to some of the negative information, the misinformation can absolutely be triggering. But we do have to try and get a sense for ourselves as to whether are we appropriately washing our hands? Are we appropriately using hand sanitizer? Or are we engaging in an action that perhaps makes us temporarily feel better in response to maybe the information that has come to light? And then we notice, well, maybe 5 minutes later, I'm feeling very anxious again. And so those can be really important signs of perhaps something more pernicious that might be going on in terms of using behaviors or activities that we think are helping us cope, when in fact those activities are perhaps causing negative thoughts, health anxieties to become more entrenched, sort of more preoccupying more of the forefront of our mindset. For many people who go on to develop an obsessive-compulsive disorder, they've typically reached the point where they are aware, and it becomes apparent to them that they're washing their hands in response to distress that they feel is uncontrollable, and perhaps that compulsion, whether it be washing your hands or counting or some other behavior that doesn't necessarily specifically connect to the distress that you're feeling, is actually just a way that you feel you have some degree of control. But in fact has nothing to do with your hygiene or your need to address your hygiene. So I think it's important that, of course, we be mindful of the public health measures around our personal hygiene and keeping physical distancing, but also trying to keep an eye on when those behaviors are sort of going beyond what we would expect to actually address some of our concerns and our anxieties, and begin to ask ourselves questions in those moments of self-reflection as to, you know, what if any benefit am I getting from some of these behaviors? And I think, as depending on the answer to that question, will really determine whether a person is acting appropriately, or where, you know, along the continuum of mental health, are they on their way to becoming ill, right? Is there some sort of psychological injury that is starting here, some sort of psychological damage that you might want to take a closer look at?
Can I follow up with another question, Dr. Joseph?
Yes,
and this is around you know, we're talking about mental health and how we should cope if we have anxiety or stress, but how do we monitor our own mental health, and what is healthy in this particular situation? I know, you know, we are under extreme kind of difficult situations, and what would be a normal reaction to the situation that we're faced, so that people can gauge and say, you know what, like in my experience of doing some other work around mental health and PTSD with people who have who have come from difficult circumstances, whether it's war or issues of violence and stuff, there are certain reactions that are normal reactions. It's actually disturbing if somebody is not showing those normal reactions. So how do we, what is healthy mental health in our current situation, and how do we continue to monitor that?
Yeah, absolutely. From when we think about what it means to be healthy, what it means to be mentally healthy in particular, we need to appreciate that our emotions have functions, right? There's a certain reason why we have even negative emotions like sadness or anger, worry. All these things have adaptive functions, and under certain circumstances actually allow us to function in an optimal way. So being in this extraordinary situation, unprecedented in modern times, it's absolutely normal to have fluctuations in mood. Where we begin to become more concerned is when we notice that those moods those fluctuations aren't temporary, that they seem to be more persistent. As Dr. Williams mentioned, when the things that we're noticing start to interfere with our everyday functioning, our basic routine like sleeping and eating, our ability to be with our families, our ability to work, what we understand to be feeling like our usual self. Now, it's many of us right now, we don't feel like our usual self, and that's okay. We have to try and find our best way to be, to show compassion towards ourselves, to be kind towards ourselves in the same way that we would show that compassion to another person. At the same time, each and every one of us are the best experts on ourselves. And we know we have that inkling, that feeling we know when something isn't quite right. And sometimes, you know, it's a natural human inclination to want to push away some of those negative thoughts, to sort of put them into the sort of the back closet of our mind, and maybe we tell ourselves we're gonna come back to them later. Maybe we hope never to see those thoughts or think about those things again. But what can happen is when we're under chronic stress, you know, those strategies that we have to put away negative thoughts, negative stressors, they just don't work as well anymore. And in a lot of ways, then we become confronted. We become confronted with some of those ideas and thoughts that were distressing that we haven't actually dealt with. And so really, this is the mind's way. When we notice that we're starting to think about these negative thoughts, that they're persistent or they're getting in the way of us getting things done, that's our mind telling us that we need to address these issues, right? And so, you know, in the spirit of being kind to ourselves, I encourage at least my clients to say, well, to thank themselves. It's like, thank you, mind. You're telling me something, right? We're sort of ringing the bell. All the signals are there that, you know, perhaps I need to do something about this. So what people notice more in themselves, or people are more likely to articulate, is maybe their low energy, perhaps physical symptoms, right? Like muscle tension, headaches, trouble sleeping. Maybe they may talk about feeling like nervous or having nerves. They might notice, you know what, lately I haven't been wanting to talk to people, or, you know, I just feel like I can't handle being around people. And so each and every one of us, I think, to some degree, knows those signs when we're not doing so well, right? So in our moments of self-awareness, when we're reacting, we really need to try our best to be aware and to recognize our limits, right? So those initial signs, what do we need to do? Perhaps we need to get more regular exercise. Perhaps we need to look at our routine. Perhaps we need to look at whether we can seek supports. Perhaps we need to really push ourselves to reach out to people, knowing that, you know what, you might not feel like it initially, but for most people, after they've gone through the process of, or after they've reached out and they've connected, they usually say that they feel so much better. So all of these little things that you can do when you start noticing the signals, when you're reacting to the stressors, like when you're feeling overwhelmed, are important to really to provide a buffer before we start becoming what we might think of as more ill, right? And so when we're actually ill, there's a breakdown in our functioning in a lot of ways. We might notice that our relationships have really dissolved. We might actually be getting feedback from people in our lives that we're just not, you know, that's something does not seem right, and you know that we're not who we just don't seem like our usual selves, who we used to be. And usually by the time other people are noticing that, we've been noticing that in ourselves for a long time. But sometimes it does take that person in your life, regardless if you're close or not, to say to you, hey, like, what's going on? And so it's really important, again, with this, when we're talking about social connection, that we you know, even a simple act of reaching out can really make the world of difference for a person and change the trajectory, their pathway to coping with whatever might be going on with them in their lives. You know, when we think of having a mental illness, you know, we think of perhaps concepts like depression, like anxiety, and from a clinical perspective, you know, these are when a person is experiencing them sort of day after day. And in a lot of ways, they might feel that they're having, you know, a lot of difficulty climbing out of that hole, right? That's at the point where they perhaps need some assistance to just give them that momentum to get started, right? To reach out and seek consultation so that they can regain their physical and mental health. But in a lot of ways, talking to someone is the initial first step. After, if you're noticing that your efforts to maintain your self-care aren't really going as well as you hoped, and that can include talking to your friends and family, but also definitely we hope people turn to professionals for support if they're really feeling that they just really need some assistance with this. And I think Dr. Khenti had mentioned, you know, how people reach these professional formal supports sometimes at a point where what they're dealing with is really quite severe. And so, you know, I really do encourage people to, when they can, if they're even noticing mild symptoms, you know, there's a lot of stigma around reaching out especially for mental health help, around perhaps, you know, things not being bad enough or hoping that things will get better. And yes, sometimes they do. You know, things are constantly changing in life, but sometimes perhaps things would get better faster if you had some support. Perhaps you would have long-term strategies that might prevent you from experiencing this again. And at the end of the day, you know, sometimes we don't know what we don't know, and the resources, the techniques, the insight and the things that we learn about ourselves through the process of engaging in mental health care are invaluable tools that people will then carry with them for the rest of their lives. And in a lot of ways, regardless of, I mean, we're dealing with this pandemic now, but I think we know one feature of life is that, you know, it's ever changing, and to some degree we have to expect the unexpected. And having these tools at hand, knowing ourselves and knowing how we can best use these tools to catapult ourselves to optimal health, which includes optimal mental health, is really very important.
I'm muted. That was very, very helpful. Thank you very much. If I could come to you, Akwatu, because and there was a question or a comment earlier on in the chat. We're talking about social determinants of mental health, as you know started at the beginning, and there seems to be something that we're not talking about, because that's what is creating this compounded challenge around COVID-19, particularly how this has impacted the Black communities. And so why the Black communities and racialized communities to such an extent? And what would be strategies then, both as individual communities, but also as a system, of how we can address this challenge?
Yeah, we get this question in various ways. And one of the points one needs to make right at the outset is people of African descent aren't getting COVID because they're Black or because they have African descent. There are no genetic markers that make people of African descent wherever they're from. And, you know, Africa, of course, has the hugest diversity, DNA diversity, genetic diversity. There's no marker that makes you susceptible to COVID. What happens in Western countries is that socioeconomic vulnerabilities are compounded because of that racial proxy marker. Yeah. Housing, occupation, public transport, and income, the pay. When you add it all up and you sort of multiply it by systemic racism, you know, the things that happens when you're over-policed, under-supported, you get underlying conditions such as asthma, heart disease, diabetes, high blood pressure, which if you have those 4 underlying conditions and you earn less than $30,000, the chances of you having a severe COVID response multiplies. So it's the compounding of social vulnerabilities for which race is a proxy indicator. There's some Black people who aren't at high risk because they have high income, live in a very nice neighborhood. They don't use public transportation, and they can work from home. But the vast majority of Black people earning below $50,000 don't have that option. They have to go to work. They can't work from home. And they live in high density housing areas where social distancing is problematic, and they don't have sick days. So they're disinclined to take tests because if they take a test, there's no compensation to pay their bills, and they want to pay their bills. So there you go. There you have it. Compounded social vulnerabilities. I've argued that if we had a socioeconomic vulnerability index, and we were prepared to use that as a society, it would take us to the same outcome, and it would probably be better in terms of some of the counter arguments that are being made as to why would high positivity racialized neighborhoods get the vaccine first. For the same reason that the homeless gets the vaccine first. They're more likely to test positive, and if they test positive, they're more likely to die. But it has nothing to do with race, yeah. Does that answer the question?
Yes, you did. And I'm just checking if any of the panelists have anything to add. I've got two more questions before we go to our participants' question.
Yeah. Could I add to that? Could I add, if you don't mind, if I could add to that? Because I know that there's a related sort of explanation that is very important. Because African and Caribbean countries have done well in containing COVID, which really speaks to the genetic vulnerability that doesn't exist. And they've done well without access to the vaccine because they did four different things. They acted decisively early. Lesotho shut down the country before they had one case of COVID. The place was shut down. And when they opened up, they got a case and then they shut down again. That's number one. Drastic measures were taken early in most sub-Saharan African countries. Thus it is that Africa has 37,000 deaths in December compared with 580,000 across the Americas. The second important consideration that really explains why Caribbean and African countries did well compared to Caribbean and African minority populations living in Western countries is because of the huge public support for public health measures. And that huge public support for public health measures comes from experience with Ebola, Zika virus, these other infectious diseases that Africa has had to deal with without much external support. So they learned the lessons. Uganda itself is an exemplary country in this regard. So that's number two. And number three, Africa, the Caribbean, Latin America has a much younger population than Europe and North America. And demographics, that's the demographics that matter because we don't have that frail elderly population that's more at risk to the same extent as Western countries, which is important. It's an important consideration for climate. We live outside in Africa and the Caribbean. You know, the climate allows you to, you know, you don't live in the house in the same way that people live in the home. I mean, that have to take a long explanation. And fifth and most importantly, perhaps, which ties into the work that you do, they have strong community health centers in sub-Saharan Africa. And those community health centers play a role that would almost be unimaginable to a community health center like Taibu. Because it's really about social determinants in a way that we talk about, but we never get to. You address education, you address housing, you address transportation, you address income. Because you realize if people don't address these issues, they're gonna get sicker, they're never gonna get medicine, they're not gonna take the medicine. You gotta talk to the elders and make sure that they're on board. I mean, a lot of things happen in these societies, in community health centers that really solidified the public support for the work of those centers. And we don't have that here. We don't have the same level of public support for community health centers in Ontario, even though community health centers play a valuable, I should say an invaluable role in serving the needs of the marginalized populations. I mean, I could argue why aren't they at the center of vaccine distribution for the marginalized populations, given their pre-existing relationships with these communities. Anyway.
Thank you very much. Actually, you know, I'm glad you touched upon that because there was a question from our participants. You know, how is it that countries in Africa and the Caribbean are doing much better than we are doing here? So I think that assessment and analysis, I think, is very helpful. I think it's very helpful. A couple of things before I go into questions from the participants. One is around the impact of COVID has also something related to mental health and addictions, obviously. Something that, you know, our communities, and you might correct me, Akwatu, we don't talk much about substance use or addictions. We talk more about mental health, and that is also another area where we have stigma, but there is a discussion, or there is some understanding that out there, because of this COVID stress, there is potential increase in alcohol intake or use to deal with the stress. And if I'll start with Dr. Natasha Williams to see if you can share some of the strategies or the work that needs to be done, or for people to be mindful of how to deal with this potential risk of getting into, usually stress is a contributing factor to those kind of things. So and I don't think it's just alcohol, it could be other substances as well.
Yes, yes. So I mean, I'm glad you've also prefaced that as well, because we want to look at substances, period. So what I think is also very important is that, I like to take it from a very stepwise approach. So we have to look at, first of all, what was this person's substance use even prior, and how had they been using substances in the past? When we talk about the ability or inability to cope, if coping was connected to the substance, then the coping that is going to then continue and possibly exacerbate as we are in this current pandemic. So we have to look at the pre-existing history of how an individual utilizes or abuses substances. A lot of times where the substance abuse comes in is that how am I able to numb a lot of the feelings of being overwhelmed that are going on within me right now? So if I can take a substance, drugs, alcohol, whatever the case may be, so that I can feel a sense of peace or numb feeling how overwhelmed I'm feeling. And if I can get that peace, even if it's for a moment, I'm going to do that. If that was how the substance had been used beforehand, and now that we're in this pandemic, which doesn't have a rule book per se in terms of how to cope with it, then what happens is I'm going to go to that resource that I've been using before and continue to use it and use it more frequently, because we're in such unprecedented times, and the anxiety is heightened, but also that sense of emotional unwell or unrest has been intensified. So because that emotional unrest has been intensified, I'm going to utilize substances even more so that I can hopefully get that sense of calm or ease. What they will notice then is that with the increased use of substance, it is going to be an even a larger call out for help. So when we are noticing then that I'm using substances, for example, to mitigate my day, to get to sleep, I can't fall asleep without the substance. I'm unable to cope through the day or manage through the day. I had a client who basically said, if I don't smoke marijuana, I cannot handle my children, or I can't get through the day. So understanding that there's an inherent need for the substance just to get through my day-to-day activities. That in and of itself is a call out for help. And even with what Dr. Joseph said, being able to say, you know what, I do need help, and it's not a problem to actually reach out for help, and to actually reach out with the help of professionals as well. And there's no shame in that, because the more that the problem becomes entrenched, the more difficult, not impossible, but the more difficult it becomes to actually manage or mitigate the problem as well. So, and the other thing as well is that with a complex problem, I also believe there should be a multifaceted solution. So part of it can be, how do I reach out to professionals to assist me with understanding how my substance use is impacting my day-to-day, and is actually negatively impacting my quality of life. But then also multifaceted, and in terms of our Black communities, it's not just professional help, it's being able to, again, we talked about being able to be connected socially and also be connected spiritually as well. And this is where I talk about how does our faith-based community also come into play in terms of the multi-leveled way that we would deal with our problems. And we're talking about the church, the mosque, all of those institutions that can also play a role in our emotional health and well-being. But if we look at it as a multi-leveled approach to dealing with those issues, then as Black communities, we would be able to address, I think, the problem adequately.
Thank you. Dr. Joseph, do you want to add? But I have a question for you, or if you could add to Dr. Williams's, but also the other area of what we're witnessing is really the challenge that parents are facing, not just about the COVID, but how the impact of COVID and the online education with children, right? And then so the parents are really finding it difficult. Like some people, when I was talking to them, I get the sense that it was very easy before. I mean, easier before, let me just qualify that, because they would send their children to school. The school will deal with most of the challenges during the day, including education and stuff. But now parents have become educators in addition to being parents, in addition to working from home if they have to or not. And so that is also another area where parents are struggling, and whether there is some kind of a guidance, support, information, advice for that kind of a situation.
Yeah, definitely. Maybe I'll start with adding a bit to what Dr. Williams was talking about in terms of substance use, and then I'll move on to the second part of this question. But only to say that the right now there are many agencies who are collecting data around changes in the mental health status and also the frequency of alcohol and substance use. Right now, emerging is, I think we've all felt, and I think perhaps with recent conversations around mental health stigma, to some degree, we're a bit more open to speaking about some of those struggles. I would say that perhaps with substance use and substance abuse, we have probably a bit further to go. There are the substances, alcohol, cannabis has been legalized, that I think have been integrated as a tool for many people to cope with stress of various sorts. But with increasing stress, with chronic stress, can sometimes come in an over-reliance on those particular tools, and what can offer a temporary escape or respite from stresses when used all the time can start to lead to a much larger problem around tolerance for those substances, growing tolerance for those substances, dependence on those substances. And in a way, it can be a slippery slope to those substances becoming a more central part of your life and the main vehicle around which a person copes. And so sometimes I think people notice that they're going through that transition. They might say, well, oh, they might find themselves perhaps purchasing more alcohol, purchasing more cannabis than they might typically do. Other people might comment on, hey, is everything okay by nature of how much they are consuming? They might come into problems with the law or have and other issues that relate around their use of substances. And when it comes to the point that the use is in a lot of ways becoming a fixture in their lives, that's where we should start asking questions of ourselves, and when clinicians start to ask questions, and when they sort of get that impression. So I think a lot of folks have been doing their best to try and be mindful of the ways in which they're using substances and alcohol to cope. But then also acknowledging that it's difficult, and when you might feel that you have no place else to turn, and when talking to others might not be your natural inclination, I think it can be easy to fall into some of those traps. Absolutely. I would say that most mental health and addiction services, most mental health providers are aware of the ways that substance and alcohol use does interact with common mental illness, well, a variety of mental illness, really, because it is a way of coping. It's just that it can become a maladaptive way of coping. And so bringing those concerns along with any other concerns that you might have to your doctor or to a therapist, or even if you're wondering whether it's worth looking into. Let's say if you notice that you're using more alcohol or substances more than usual, and you do your best to cut back, but you notice that you're really struggling, that should really, trigger you asking yourself perhaps some tough questions about, how it is that you are actually doing. And, given that we're looking at a long-term approach to coping with the stress of the pandemic, what you might be able to do to mitigate any more severe problems down the road that might be a byproduct of coping with the stress of this pandemic. It's okay. I'm at that point, I'm going to turn to the second part of your question. I got you. Okay, perfect.
Thank you.
It's interesting. I think, those of us who are parents, especially those of us who have school-age kids, have really struggled with balancing all the aspects of life in addition to schooling, educating our children. And I think we've all had the utmost respect for educators to begin with, but this experience with virtual schooling has really, we tip our hats to those educators who I know really have been going to bat to do their best to provide an education to our children virtually, and having to adapt and adjust to all the different changes and policies. So I think, it's really it's been a juggling act for a lot of parents trying to add an additional role in their lives as worker, maybe as mother, as short order cook, all the other things that help get our children through the day, especially a day of virtual schooling. It can really become overwhelming, and sometimes that can add to conflict and tension in a household when there are so many other demands. And I think right now, I in moments like these, at least for myself being a parent, I try to lean into the power of dialectics, and part of what that means is being able to appreciate that there can be many things going on in the world. Some may be difficult, some might be great. They exist at the same time, and that's okay, right? That change is constant, that we should expect change, and we do our best to be flexible and to do the best that we can. So I would say it's really hard as a parent to get down on yourself, to maybe feel that you're not able to keep up and fulfill all of these roles that have been thrust upon us in a certain sense. I think when you become a parent, it's almost like an unwritten social contract that you have a village with which you are supposed to be raising your child. And with this particular pandemic, a lot of that village is sort of evaporated, right? And so at the same time, you're still met with all these expectations to fulfill. So you become the village. And I don't think that anyone has ever really expected that to be, the objective, the achievement that we need to attain each and every day to be that village. What we can do is that we can try our best to make sure we take care of ourselves so that we can take care of our kids and provide a safe space where they can learn, where they can grow, and to acknowledge that that we are resilient, our children are resilient in many respects, and that there's going to become a time when we balance this out, when this balances out. So do we need to hit every objectives, all these parenting goals each and every day? I think it's better to take the long-term view. What can we do in any given day? What does that look like over the short, the mid, the long term? Do our best to plan where and when we can, with an eye to anticipate at least that we might need to sort of shift and make changes, and to trust that in a lot of ways that these things are going to come together, and our children are for the most part, they're going to be fine. Now, does that mean we shouldn't pay attention to perhaps signs that they're struggling, that, you know, as for ourselves, we're trying to implement routine and structure and fun. You know, we need to try and do that for our children too. In many ways, when school institutions shut down, you know, that was a shutdown of a lot of our children's lives. And you know, the structure of school really plays a big part in their emotional well-being. And so it's important that we do the best that we can to support them in having that connection. That's a major part in our lives, in addition to the parts of our lives. And so, I mean, admittedly, it's definitely a balance act, but we need to do our best to be kind to ourselves and to be as assured as we can be that in this circumstance, everyone is trying to make the best of the tools and the resources we have available to us. And as long as we're able to sort of anticipate to some degree what the stressors, to plan around those stressors, and to build in ways to support ourselves in the long term, that we're going to be okay.
Thank you very much. I think that was very helpful. We already know that when we become parents, you know, we don't get this guide, you know, how to make it happen. We learn as we grow together with our children. And now with this issue, I think it's also good to acknowledge and try to find ways of normalizing the situation that we're going through. I'm just seeing that number of questions from our participants is really growing, which is a great thing. So I think we need to move on to their questions. And the first question I think we would like to ask is, are there, so there's one question that asks whether there are Black organizations who have access to crisis line supports. I don't know if Akwatu, do you want to tackle that, or?
Yeah, well, you know, again, yes, there are, and is a short answer. And you need to go to torontocovid.ca, and you'll find the whole list. And it depends upon what you're actually looking for. But if LGBTQ plus issues across boundaries has a lot of resources, and the environment is very welcoming. Then there's Black Cap, and Black Cap again is you know, doing everything, not just LGBTQ plus, but transgender youth as well, who face many issues that get amplified during the pandemic, especially with respect to homelessness. But you know, visit toronto.ca, and you'll find many of the organizations that are listed. I know Taibu CHC is also, if the last time I looked at that list, you were included in that list, yeah, as providing support for LGBTQ plus youth and young adults.
Right. A part of that question was also whether there has been any studies how COVID is impacting that particular population. I'm not.
Yeah, no, there's no studies that I could talk of off the top of my head, but 2019, there was a study that was showing that in the Black communities, LGBTQ plus accounted for a significant share of the homeless population. And the reason many of these young people were homeless is because they experienced family rejection when they came out. And so that speaks to several dimensions of challenges that we face. So that's amplified by COVID. I mean, like somebody, you know, you can't get around it. So COVID really puts a lot of young people at risk. And that's why not only are we having verbal and psychological abuse, but, you know, a lot of police intervention because things have gotten out of control.
Thank you. The next question, and I will open it up for our panelists to just jump in and answer the question. So how can we as a community grow from this pandemic experience? Has there been an increase of resources or funding to support these services? So I think the first question is, what is the learning and how can we grow out of this pandemic? So any of the panelists, or Dr. Natasha, please.
Sure, I'd love to get started with that. I think what we have to really understand, especially us as Black communities, and we use this term a lot, but it is very prevalent for our Black communities, is resilience. And the reason I bring up that term is because, you know, we continue to remain resilient in the face of significant disparities. We've been doing it, we continue to do it, and it's not belittling that we're part of this experience in terms of the pandemic and COVID, but what's important that we understand is that we've also, as Black communities, we've learned how to pivot. We've learned how do we, you know, manage in the face of overwhelming circumstances and those kinds of things. Now, mind you, it's in that survival that we've had significant issues of transgenerational trauma and traumas that have been multi-layered over the generations. However, what we do need to not to lose sight of or lose hope in is that as communities, we've always been able to learn how to pivot, how to be able to look at the circumstances as we see them now. We may not be able to cope as we did before, but what we do quite well is that what do we do with what we've got? And I think if we start from that premise and say, okay, COVID has taken away, you know, our ability to be mobile, to our freedoms, our abilities as Black communities to congregate. How do we pivot, and then what do we do next? How do we then, as what Dr. Joseph had mentioned, you know, how do we pivot to more of a social media or online way of being able to do the things that we did before? So we're using another platform or another medium to do the things that are so inherently dear to us as Black communities. So a lot of times what we do as being resilient and resourceful is we don't lose the essence of who we are as Black communities, but what we do very well is we figure out how do we do those inherent things, but in a different way. And I think once we continue to look at this pandemic in that way, we're then able to then pivot, but pivot adequately and not lose who we are as Black communities.
I could add to that.
Yes.
If you want. Yeah, I think we need to rethink parenting and extended family as a sort of a protective factor, because we've gone through cycles where we've changed the extended family through necessity. I mean, like when we came over on the ships and were separate, you know, we weren't families on that ship because we had been separated from our families, and we quickly formed new family bonds on the plantation and after the plantation. And in the early part of the 20th century, when there were these mass migrations, new relationships evolved, and people actually took care of children who weren't theirs. We never really had the same level of adoption as people of European descent, but we had different practices where people actually, I guess you could, for want of a better term, adopted children in need, and they became part of their families. And so I think that we need to rethink parenting. It's one thing to be isolated pre-pandemic or post-pandemic, but during the pandemic, it takes you from into crisis. And you know, there are more pandemics coming, environmental crises. So we need to actually think of parenting and the way we think of senior care or elderly care, home care. How do we support parents in their isolated locations to better parent, to give them relief breaks, to go in there and make sure that the skill sets that they're imparting are the ones that the kids needs to survive in this community, not just survival skills, but prosperity skills. And I was involved in a project in the early 90s called Facilitating the Academic Success of Black Children in Canada. Talked about confidence, creativity, credibility, control, etc. What it didn't talk about was socioeconomic inequalities and structural racism and how to deal with that. So that's one. On the sort of the protective factors side, we need to rethink parenting, and we need to actually think outside of the box. Don't be wedded to the nuclear family model, because the nuclear family model never served us well anyway. It wasn't a model. It's a model, a 20th century model, mid 20th century model imposed upon us in some respects. I also think we need to look at ourselves, look at our stigmas. We're asking the society to address its anti-Black racism at a deep level. We also need to address anti-Black racism at a deep level, because we self-stigmatize, but we also need to address some of these other issues that we just will not deal with. The LGBTQ plus issues that's not going away and causing a lot of harm and health harms and pain to family members. I don't think there's one family member that doesn't have someone who's LGBTQ plus, but very few people want to stop the othering and create a culture of belonging for all of our children, all our young people, all our adults, young adults. I think this is a time when we really come face to face with these multiple stigmas that we expect the society to address. We also need to model what we expect others to do, because we have stigma burdens that are also preventing us from moving forward. We need to address that. A lot of ethnic issues, man, a lot of intergenerational issues. We don't handle intergenerational mobility very well. We don't handle power transfers between seniors and youth very well. These are things we need to actually learn how to do, because the crises aren't going to stop coming. So that's why I'd say a crisis, but it's an opportunity. There's a silver lining that doesn't validate the crisis, but that still you can just grab the silver lining anyway, because it's there to be grabbed.
So thank you. And if I could come to you, Dr. Joseph, and continue the conversation, but there is a question from the community around insights on how to deal with caring for older parents. And we talked about parents and young children, but how about parents who are caring for older adults, and whether there is some insight on the challenges and what can be done in those respects, if that's okay.
Absolutely, and I'm open to contributions from the rest of the panel as well. But I would say that in addition, in COVID, in this pandemic, many of us have had to adopt many roles and had to juggle. So even for those of us who are managing parenting related issues and the stressors associated with that, some of us also are managing the care of elderly parents and trying to figure out how we can support them, and that might look different depending on the arrangements for elderly care that may be put in place. Some of the elderly people in our family might be in long-term care homes that have had very strict precautions for good reasons, and allowing contacts with family members who have served as primary caregivers, even though they're in these facilities. I think what we've all come to realize, particularly in long-term care homes, is that families were always providing that sort of that extra bump of care to allow their family members to be comfortable and to thrive in those settings. And without the contributions of those families, with the restrictions, that this is where a lot of the things really start to fall apart. We actually came to see where all of these gaps in terms of personnel and management of day-to-day care were actually caught. There were major fissures that became huge gaps that were insurmountable and really amounted to some degree of neglect for this particular population. And I know there have been a lot of families that have been coping with a lot of guilt, a lot of worry, a lot of concern around them not being able to support their family members in the way that they would like to. And of course, doing their best with reaching out, with connecting socially and hearing about the trials and tribulations of family members who are stuck in those situations. It's been absolutely heartbreaking. And so I think now there is a little bit of movement in terms of families, perhaps in those scenarios, being able to have some more contact, perhaps are first in line to get the vaccine so they can provide that kind of help. And that's, that's great to see. However, we've had months where this is not the case, and a lot of families have incurred major losses, major blows to their family systems, with the loss of people that they're near and dear to their heart. And so for those individuals, I'd like to say, I'm sorry, and I think a lot of us perhaps were aware of struggles in these areas, but never really, it was hard to see how this would come to bear. And I think we had some warnings, perhaps a lot of warnings, people yelling from the rooftops, but only saw when in this crisis situation, how that actually was going to play out. And so I do think we all have a responsibility to continue to speak out, to voice our concern as a society where all of us are trying to be citizens that support the vulnerable and aim for equity in the care that's provided to all of our citizens. To say there's a problem. We know there's a problem, and now what are we going to do? What are we going to do about these things? I know for some families, perhaps this call is too late, but I think for many of us that are working in health services in general, in public institutions in general, are really committed to seeing this change and supporting this change where we can.
I was unmuted and then I muted myself, and I'm trying to figure out what I need to do. So I'm going to pause here because we have one more message from our other panelists that we have not asked any questions, Dr. Quan Mckenzie. So I'll ask my tech people to give us the second and last message from Dr. Mackenzie.
There are lots of things we can do to increase our resilience to mental health problems during COVID. The literature about mental health resilience says there's 5 things that we should all be doing all of the time. First is staying connected to friends and families, and actually seeing and hearing people through Zoom or Skype is better than text. The next is keeping active. Well, we know this anyway, because we know that a healthy body produces a healthy mind. So exercise every day is important. When we're thinking about building a healthy mind, actually learning something new keeps our brain active, and it keeps our brain as active as our body, and it builds our mental resilience. Then there's this idea that this 4th thing people talk about is mindfulness, and there's lots of courses online you can do to make you more mindful, but what you're actually trying to do is work out how to enjoy everyday things and be grateful for things that are going well. And then the last thing that produces general mental resilience is giving back. Volunteering, doing things for other people, actually makes you more mentally resilient. It puts your brain in a different place, and there's a lot of pleasure to be had by doing things for other people. So that's this idea of a general mental resilience. And then there are 5 things that people say we should be doing on top of that for COVID. First is have a daily schedule. The second is be kind to yourself and others who you're in contact with. The third, don't drink too much alcohol, don't take too many substances. The fourth, communicate. Tell people how you're feeling, talk through your problems. And then the last, be careful about how much COVID news you take. If you're in COVID all the time, hearing all the scare stories, actually that's not great for your mental health. 15 minutes of COVID news a day, focusing on things that you can do rather than just general worry, is going to actually make you more resilient. So if you can do those things, those 10 things, 5 general things, 5 things specific for COVID, then you're going to be more mentally resilient. If you're struggling with a mental health problem during COVID-19, there are 3 ways of getting help. First, you can tell someone close to you how you're feeling. Let them know what's going on. A problem shared is a problem halved, and they may be able to help you get help. Second, well, there's now lots of help available on the internet and at the end of a telephone line. There are websites such as Bounce Back and Big White Wall that offer tools to help you build your mental health and deal with problems, as well as online supports. And then there are free crisis helplines for both youth and adults. And then there's therapy that's available online that you don't need to go to your doctor and get a referral for. So in Toronto, there's free culturally sensitive counselling. And in all of Ontario, the government has made therapy free online. Third, well, there's what you do in a crisis. The normal ways of getting mental health services are still there for you. If you're in a crisis, you can still call your doctor and you can still go to an emergency room or to the emergency department at the Centre for Addiction and Mental Health. You can still call 211 for help, and if it's an emergency, you can still call 911 for help. Help is out there. Getting help is possible, even though we're in the middle of a pandemic.
Thank you, our tech support people. That was, I think, very useful. One thing I didn't tell you, though, was that there was going to be a test after the audio to remember those 5 things and 5 things and 3 things you can do. I'm joking. There's no test. But I think some of those very succinct, information that Dr. Mackenzie has provided us probably would have given us some of the ideas of some of the questions that have been asked from the community. So are there any comments, additions, reactions from the panelists from the audio that we heard from Dr. Mackenzie before I go to the next community question?
No, I think Dr. Mackenzie's comments speaks volumes.
Yes.
We have a much more significant commitment from the city to get through this than ever before. And they're committed to equity, and they're supporting 12 organizations across the city to provide emergency wraparound services to individuals, which includes, if you're having problems getting food, getting medicine, mental wellness checks, access to mental health services. I mean, the whole, even if you need emergency funds because you've lost your job and lost your income, all of these things are considered part of the sort of COVID package, so to speak. And it's there for people to use, and we need to use it. There's no blame and shame to go around. We're all experiencing in economic and mental health stress, and in some cases distress, and there, but for the grace of God, go I. Whoever is in a particular situation, take the situation in hand. Don't deal with it by yourself. Seek out the help, secure the help, get the help. That's what I would add.
Thank you. There is a question, so if we have comments, we can add to the comments. But there's a question around support workers. I think we know that they have been impacted, being a frontline workers. And so the question is, what advice would you give to support workers caring for older adults who are already somehow isolated? Open to the panelists. Okay, Dr. Williams, thank you.
I'll get started. And I think it really speaks to care for the care provider. And I think a lot of times we miss this piece because we are as frontline workers, as support workers, we're so enthused to ensure that we are taking care of others. What we do is we end up neglecting ourselves. So as support workers, I think it's also important that as we are charged to ensure that our Black communities are receiving the best care possible from us, being able to do that while we are running on empty, or as support workers are running on empty, does not make sense at all. So I think what's important is that support workers also understand that they need support too. And to be able to do that, do they need, as much as we are in the trenches, do support workers need to take some time for themselves, even if it's for a minute, to be able to replenish, rejuvenate, to implement a lot of the strategies that Dr. Mackenzie was talking about. Because again, if you're unable to take care of self, you're already working from a depleted place. So being able to, to get that exercise in, I would also add adequate sleep, as much as difficult as that is. But again, if you're running from a limited battery source or from limited energy, you really cannot, serve the community as you would like. So the same vigor and energy that we use in terms of serving our Black communities, we also have to understand that we are also worthy of that care as well. So what do we implement? Is it being able to eat nutritionally, nutritious food, being able to engage in that, being able to replenish that energy? Is it adequate sleep? Is it exercise? Is it also making sure that as support workers are also connected? Because being able to have that connection and actually connect not only just with family and friends, but possibly with other support workers as well. So that sense of community, that sense of commonality when it comes to support workers is also going to be of the utmost importance, because that honestly rejuvenates and replenishes the soul when you're able to sit with other support workers to actually discuss and talk about the work in the community, and being able to say that you are not the only one, that this fight, this pandemic, or the way that we're navigating this pandemic, it's not a solo venture. It is actually a community venture that we can navigate together. So being able to utilize those same core principles as support workers and make sure that we're utilizing it for ourselves or for themselves is going to be of the utmost importance to navigate through this as a community.
Thank you very much. Other added comments, or we can move to the next question? Okay.
I would just add quickly to that one of the things that could make the work of the job of a support worker easier is to connect to families. A lot of support workers who don't share the same cultural or ethnic background of Black seniors sometimes are at a loss because the Black seniors, feeling isolated, need validation of their own. They need connection of their own. And sometimes that's help if the support worker connects to the families and becomes a bridge to families. I know it helped with me because my dad was isolated and the support worker connected to me. Self-care is a big one, and that was expressed, elaborated. But I think that the dignity of support workers needs to be protected, because 13% of the workforce are racialized, 27%, 27% of social support workers, so 2 times as much Black and Caribbean women and African women, also many Filipinos and South Asians as well do this type of work. And what's the insult that's added to the injury is to be underpaid, under-supported in terms of sick days, but then have to deal with a lot of racial discrimination that's not taken seriously. It's almost part of the job. And we really have, that's where the whole anti-Black racism thing has to go. So that you deserve a basic income, you deserve 5 sick days, but you also deserve to work free of racial indignities, where people telling you, that black, get your black hand off of me, and you're cleaning their poo, but they're telling you get their black hand off of them, that kind of thing. So, the dignity of our social workers need to be protected. And taking anti-Black racism seriously out here in society, but we also need to take it seriously inside our nursing care facilities, our residential homes, etc. So that their daily lives isn't just a mix of drudgery and indignity, their dignity is protected.
Thank you, Akwatu. Another question that was there, I think we touched upon it, and Dr. Mackenzie also touched upon it, around balancing, keeping up to date, but also managing anxiety and worries. There's a question of what's the best way to do that. So I think Dr. Mackenzie said, no more than 15 minutes on the news and social media, but do something else or watch a movie or something like that to help you with your well-being, but also keep informed, I think is the answer to that question. I don't know if there is anything to add to that, or Dr. Joseph, you're unmuted. So, both doctors are, or 2 doctors are already muted. So let's go.
Dr. Joseph, did you want to go?
Yeah, I'll offer a brief comment to underscore, yes, the idea of balance. And so to some degree, it is necessary to have the up-to-date information to know about changes in the precautions and different levels, so that we can plan our day, and also making sure that we're doing our part so that we can manage where we're at and to open things up as much as possible. I know many of us are anxiously anticipating the reopening of the economy more fully, because it has impacts on our own personal finances, but also it's a signal that perhaps things are returning to normal. And so when that does come to bear, I think it'll definitely be a sign of optimism. So many of us are anxiously awaiting, anxiously checking. And by contrast, sometimes when we see information that things aren't going the way that we'd hope, that also can bring its own distress. So really limiting our time, preferably at a point in your day where it's not going to impact your routine. It's probably not best to be looking at your social media, reading about COVID right before you're going to sleep. It's also probably not best to wake up in the morning and start your day reading about the numbers and our values and things like this. Try and put it in your day at a point where you also might have the opportunity to balance it out with a relaxing activity, to pair it perhaps with mindfulness practice, with prayer, something that balances it out. But I think most and foremost is to limit the time that you spend digesting that information, and do your best not to schedule your day around constantly checking these updates.
Williams?
Yes, it's interesting. Dr. Joseph basically said what I wanted to say. So it's actually really good, because, and I echo what she has said, because a lot of times pre-pandemic, we were so tied to our social media feeds. There was a lot of people who would tell me in particular, the minute they wake up in the morning, they're on Facebook, they're on Instagram, they're on, so what happens is that their checking of their social media feeds sets the tone for their day. And now that we are being inundated with a lot of COVID information, that is now negatively impacting how we start our day. So what we want to look at is, again, how do we schedule schedule or mitigate the amount of time that we are on our social media feeds and watching the news as well, because that, you know, the more that we're fed that, a lot of times it increases anxiety, increases the uncertainty, it increases the despair. So what we want to look at, and I believe Dr. Mackenzie also said the same thing, at what point in the day, you know, can we schedule some time to look at our feed? Because some people, it would be very easy to say, just turn off the television or just, you know, turn off your phone. And that to me is a very nonchalant way of addressing the issue. It's talking about how can we manage what we're doing instead of just shutting it off altogether. So it doesn't mean that, okay, you know what, I may watch some of the 6 o'clock news, but I may not watch the entire thing. Or if I am going to check my social media feed, it will not be in the morning, because if I start in the morning, it is going to set the negative tone for the day. So maybe I will do it in the middle of the day instead. And even to add what, you know, to echo what Dr. Joseph said, doing it at the end of the day may not be helpful either, because then if I am then being fed with all of this negative information and then trying to sleep, then it's now going to impact the quality, the length and the quality of sleep, which then also is then going to have other mitigating effects as well, reduction in energy, irritability, you know, being able to engage in other activities which are going to be helpful for our health. If I am tired and lethargic throughout the day, taking Dr. Mackenzie's suggestion of being able to engage in exercise every day is also going to be compromised. So a lot of these factors will start to compound one another. So it really is important, you know, that we do really look at how is it that we manage and ingest social media so that we are able then to actually just have a more balanced perspective.
Thank you very much. And the next question, I think, was also answered a little, but maybe if we can give, a practical example, and this is with regard to seniors being stuck at home. What can they do? I've heard Akwatu at different places suggest a few tips of doing, but I'll start with Dr. Joseph, who is unmuted at this moment, and then I'll come to you, Akwatu.
Sure, absolutely. I'm actually happy we're returning to this question, because I had a chance to look at the chat a bit and notice there were some more specific questions as to what we could do to support seniors who perhaps are still living, are living independently, yet are at the highest risk of having the most adverse consequences if they contract COVID. And I think as a family member, perhaps we might be able to support them in the use of technology if that's at all possible. And if not, really just getting back to the basics. Making sure that we're being mindful of physical distancing, but trying to engage those family members as best we can on a regular basis, if we're able to facilitate that in moments of connection, of conversation, to provide them with opportunities as well for having a positive experience and positive emotion. A lot of elderly folk may not necessarily have access to a lot of the virtual online options that the rest of us have become integrated into the lives of the rest of us, where we're able to find some moments of levity, entertainment in our social media feed or in streaming services. Doing online exercise classes, all these things that are now online that have been filling our days really aren't part of the everyday routine of some older adults. And so, doing what we can to give them the opportunities for positive experience, perhaps set them up, if it's possible, if they're open to that, to some online services, encouraging them to engage in some basic exercise if we can, to take a walk at a time, where their neighborhood may be less populated with people at a time that also works for their schedule, or perhaps with the support of a caregiver, like a personal support worker who is already in their immediate bubble and providing care. And so I think, yeah, really thinking about some of the things that they can do, that they can manage, even if we were to think about or help them think about things that they used to enjoy, perhaps at another period of their life, and using that as a starting point to really engage them in activities and to help them pass the time.
Thank you, Dr. Williams.
Yeah, I also wanted to add to what Dr. Joseph had mentioned, because right now I actually, I think of my father, who is 89 and has, does have, health issues and struggles at this point. And I was chuckling a little bit when Dr. Joseph was talking about, trying to see if they would be amenable to technology, because I'm going to add this straight. My dad, there's absolutely no way. he is so
try.
Yeah, exactly. You're like, I was thinking about the comment for 2 seconds and I'm like, you wouldn't even try. Like we tried to give him a cell phone, just so that, and that didn't even work. He goes, how does this thing work? I don't want nothing to do with this. I don't want a computer. So, that idea was squashed really, really quickly. But with my dad, what's interesting with him is that, he would do weekly rounds with us daughters in terms of, telephone calls. And I know that Dr. Mackenzie said usually doing things on social media or, like Zoom and those kinds of things are better than text. But for him in particular, we want to tailor it to where the senior is at, right? So for him, I just need to hear your voice. That's all I really want. So it was being able to call him more frequently. And then as well, we knew that there was a specific bubble because, he's of that age where, and again, with health issues, he's at that very vulnerable state. And it's him and my stepmother. So, it wasn't about visits to the home or anything like that, but there were some days where your act of kindness, being able to deliver grocery, and just to be at the door when he's inside the house and wave and say hi was enough, because he said, I can kind of see your face and I can see your person. And that in and of itself for him was a way that as a senior was being able to cope and deal with this. And then again, what you were mentioning, Dr. Joseph, as well, was also, being able to move a little bit, sort of add those things to routine. That was very important for him because he is limited in mobility. But more importantly, it's really to meet the senior where they're at, and being able to facilitate some kind of connectedness, because a lot of it's in the isolation that you'll notice that you'll see the increased difficulty in coping. So just wanting to piggyback and to add to what Dr. Joseph was mentioning.
Thank you. Akwatu, I have a question for you. And the question, I don't know if you have the answer to the question, but it says, have you seen or has there been more admission into mental health hospitals like KMH as a result of COVID-19?
No, I don't know. There hasn't been any. I haven't seen any data, but all I do know is that KMH has recently made a very significant commitment to addressing anti-Black racism within its walls. That's somewhat unprecedented for a hospital, that they're committed to rooting out anti-Black racism across multiple dimensions of the hospital.
Yeah. And
I don't know if that was preceded by incidents or just through what was happening in the society.
So, yeah, and I think for us, what we are witnessing is that there is an increased demand for mental health support. We're seeing this in, like we had to really increase our capacity to meet those needs. I mean, the positive thing about that is people are seeking support services, which we really have been encouraging for a long time. At the same time, I'm also, observing that the need must have been really overwhelming for them to come forward to ask or seek services, but at least they're seeking services. And this is also with the younger age group, so school age, youth who are really wanting to speak to somebody. So I think that's a good sign, and they're seeking service. But we had to really increase the capacity we have in order to meet those requests for services. So I think that is there, but I don't know really on the other spectrum whether there has been an increase in hospitalization or at CAMH. I don't think so. I don't know. I'm just trying to kind of finalize some of the questions we have before we begin to wrap up. I think this is more of a comment. Maybe we can reflect on the comment, but it's how about structural change for frontline Black people, right? Is the faith that we will always do the hard work and suffer to keep others safe. Maybe if there is a reflection there, and then a final thought around how about our children who are at home, not getting a chance to know or hold their grandparents or play with friends. This is such a hard time. Do we just accept the pandemic will be over at some point, or worry about lack of social skills for our kids? So 2 comments, reflection on 2 comments. One is, we are doing the work, the hard work, but we're also being impacted by it. And then how do we start thinking about not so much the idea of recovery, but how are we going to prepare our younger generation with the things that they're missing out right now? So if one person can comment on one topic, and then we'll start to bring this back with final remarks from the panelists, and then we'll close.
I'll start with the first comment, because I think, Dr. Khenti actually briefly touched upon sort of how how frontline workers and the structural issues within that area have negatively impacted. You have the frontline workers who are there's a higher percentage of Black women in particular that are doing these frontline jobs, but yet from a structural vantage point are being absolutely disadvantaged, as well as disrespected as well. So there has to be structural change in regards to increasing respect for the work that they are doing. And that, if an occupational hazard is racial trauma, then we have to address that as well, because we cannot have frontline workers going in and being inundated with racial prejudice and harm while they're trying to do the work that they are doing. So there is, it's a difficult question to answer, because we're really talking about this from a very structural, not only just anti-Black racism, but just a systemic racist perspective, which is going to take significant energy to overhaul, because it is so entrenched within that system. But absolutely, these frontline workers are doing the work, and they are being disrespected as part of an occupational hazard while they are engaged in this life-saving work. So I think we have to look at it from a significant structural problem.
Thank you. Any thoughts on Dr. Joseph, please?
And then I would just add, I guess, a reflection in that. I do think that with the pandemic and with the opportunity for society at large to have eyes on what people of color have to deal with when it comes to police violence, when it comes to structural racism, there has been a reckoning on many fronts. I would say an upswell in a lot of in a lot of public institutions, and that does include public health institutions, public safety institutions, where a lot of the systemic structural discrimination is really built into the policies and the way that our programming is set up. And so, I do see it coming, slowly but surely. that, you know, the notion of anti-Black racism, I think for many who haven't experienced it, has been a sort of an aha. And in the past, there has been an aha, but now there's the expectation. And I think people, racialized people who are working with these systems are saying, well, now what? And demanding to know now what is going to be done about these things. You know, anti-Black racism in the front line, structural racism throughout the development and the delivery of programming, and really holding institutions to task as to, you know, what is the plan, what is the strategy, what are the resources, and what are the supports to work to address this issue in a long-term manner, because that is what it's going to take. That is what it's going to take in order to shift things, is to address these in a long-term manner.
Thank you very much. So if I could come to you, Akwatu, and if you could give us kind of a wrapping, closing thoughts, reflections, and then I'll do the circle and come back to Dr. Joseph and Dr. Williams, and then we'll end up this very, very educative, informative, engaging conversation. So Akwatu, if you could please.
Yeah, so
I'll time you.
I'll stick with low-hanging fruit. Connectedness and connections must be strengthened for good, not just during the pandemic, but for good. We have people doing wellness checks on seniors who were socially isolated in their apartments, single mothers who were socially isolated in their apartments. We can't stop that after the pandemic. After, you know, PTSD issues are rising. We don't want people to go back to their loneliness. You know, there's only two ways to come out of the pandemic. You can't go straight ahead and be the way you were before. That's not going to happen. You're either going to be worse off or better off. And for us to be better off, we have to focus on connectedness and connections when it comes to wellness checks and mental health, but also when it comes to parenting and seniors care. It's one thing to have seniors in these institutions, but it's another thing for them to have no connection to the cultural life they experienced before they went in there. No food, Caribbean or African food, no music. They don't play the games that they're accustomed to playing. I know for Trinidad, dominoes, all fours, so a game we call all fours. But I mean, I know there's Zoom. People don't want to do Zoom, but they're doing bingo. So why not connect them to community games, the things that people used to do? It's a structural expectation. It's not just what you shouldn't do. It's not just expecting that the patients, I'm going to call Black people names. It's what you do for your people that are in there. And it's your responsibility to provide them with access to the outside world in ways that keeps them mentally well. Because actually losing that access advances the dementia and the mental illness more than anything else. So that and the tutoring, and just in terms of how we understand Black identity and address Black identity issues using the internet, because right now the internet has the advantage of us. It's being used for multiple purposes, including misinformation. But we also can use it for positive purposes, not just education, but socialization with respect to identity. Because the young people are going to be more accustomed to it anyway. They spent a lot of time during this past year, and they're going to continue to spend a lot of time online. We need to make sure online is safe. We talk about safe spaces for Black people, safe cultural places, but we got to make online safe for Black people. We got to make online safe for Black children and adolescents and youth. And I can tell you right now, it is not safe. There's so much lies and misinformation being disseminated as truth. It's, you know, where do you start?
Thank you. Dr. Joseph?
I would reiterate all of Dr. Khenti's sentiments, and also highlight the importance of the supports that we can provide each other informally. It's so important that we do our best to continue them those are the natural coping tools, natural coping strategies that we all have within us and within our families, within our communities, that offer a lot of benefit. And even though the settings where we can connect with people don't necessarily look like they used to look like, the connection is what is important. And so if you can do what you can to give those people who are in your life even just a few moments of your undivided attention, to do something small, to know that you were thinking of them, to give them a few moments where you're not multitasking, where you can, even virtually look them in the eye and they know that they have all of you in that moment. That can go really, really so far. In addition to that, I would encourage people to really, consider, seek out, inform themselves around all the new resources that are available in their community, whether it be in person or online. There I think might be some, I would say that before COVID, many people, many mental health practitioners had a lot of reservations around providing online services, providing virtual care. But now that we have been sort of forced into the scenario in many ways, we are finding that it's actually a very valuable tool. And I anticipate that sort of, going beyond COVID, when things stabilize a bit, that this will remain a fixture for mental health services and increase access. I think even though we will still need to address perhaps some of these structural issues for people who don't have access to the internet, who may not have a smartphone, we'll still have to look at ways to address that. But there's been a proliferation of all these different modes of care that can provide different level of intensity of services depending on where you're at. So ranging from people who are looking at how can I improve my self-care. There are many resources out there in the forms of a lot of guided interventions, like guided relaxation strategies on YouTube, to some practitioners who've written self-management guides and how to do certain aspects of care, how to track, how to take your own temperature, so to speak, as to when you might need to perhaps seek out professional help. And the visibility of practitioners who might be a good fit for you has really increased as well. And so I would encourage people to look at their options. I think a lot of people assume that when looking for a mental health provider that, the first person will necessarily be the best fit for you. And, a lot of people can acknowledge they do shop around and you find someone who you feel really maybe personality-wise, approach-wise, something about them, right, is the best fit for you. And so I think it's important to say that sometimes it takes a bit of time to find that fit. And with COVID, an increased visibility, especially of therapists of color and of practitioners who are really committed to an anti-racist approach, that that process might be sort of that much easier.
Thank you very much, Joseph. And Dr. Williams.
Thank you. I will not say too much because I do believe that Dr. Khenti and Dr. Joseph has said so much and said a lot of the things that I would have said. So I will keep it brief, and I will say that as Black communities, connectedness has always been our strength. And this is how we as Black communities have been able to navigate through difficult times. COVID has just highlighted, as we mentioned at the beginning of this panel, COVID has only highlighted things that disparities and issues that we've been dealing with as Black communities for centuries. So what COVID has actually done is just, you know, added another layer, but also on top of that has just brought to the surface, if it wasn't already so, you know, the significant disparities and significant issues that our communities have been struggling with for a significant period of time, which has included our mental health and as well mental illness. So what I would want to leave with everybody is that it is in that connectedness that we are going to come out of this and be able to thrive from it. And it's not about survival anymore. And I think that's the other thing. A lot of times we talk about how do we just survive. As Black communities, we have thriving is our birthright, not just survival. So we want to look at that within that connectedness, we can go get through this pandemic and then some and thrive. So I will leave it with that.
Thank you very much. For me, it has been a very engaging conversation. You know, there has been a lot that we touched upon. I'm hoping that the participants who you've been listening to and participating by asking questions and putting your comments, we have learned a lot. I think the connectedness is also happening here, where we are connected with information, guidance, support, advice, and also to validate the experiences that we have, right? The conversation we had around the frontline workers, that's validating the experiences that they're facing on a day-to-day basis. And that's also very important. That's also positive mental health, right? When somebody really validates our experience. You know, I haven't done a lot of counseling as Dr. Williams and Dr. Joseph, but I've done some counseling. And if you know, the first kind of part of working with a client would be to validate their experiences. And you've done that, you've already crossed half of the journey together. So this is, I think, was very, very helpful. So I am really very thankful to the panelists. Obviously, Dr. Justine Joseph, this is our first time we met, but it felt as if like I've known you for a long time. So easy to engage, and really you brought the experience, the thoughtfulness and the insight into some complex situation that we face as human beings, but also as Black people, and the challenges that we face. So I really am grateful to your input and insight and conversation. Of course, Natasha, always a great pleasure. I'm going to call you Natasha now just through at the end, but it's always a great pleasure to be, you know, in your presence to talk about the challenges, you know, working together to try to find ways of moving forward. And so that is really, you know, another great opportunity to have had that conversation. Of course, my boss, mentor, colleague, friend, Dr. Akwatu Khenti, always a pleasure. Thank you for leading this work. Thank you for the support that you provide, both for communities, but also for people like us in terms of your knowledge and experience. But most of all, two most of all thanks that I have to give. One is for the participants who really stayed with us for this long and engaged with us. So really, thank you very much for your involvement. But I can never do this, right? Our Toronto Sign Language colleagues who have been here, you know, supporting us and providing, you know, information and access to people who may not have had this opportunity to participate in this conversation. And I was telling Christopher at the beginning, I wouldn't know how to do this, right? You know, simultaneous interpretation is difficult as is, and then when you do it with sign language, it's even more complex. And they have to follow our speed and maybe even anticipate the kind of thoughts or words that we're going to be using. They have to be like half a step. So thank you very much. And of course, our how do I say this? Anyway, our special guests who was with us in spirit and in voice, but not with his presence, Dr. Quan Mckenzie, who also provided us some very detailed, very easy to remember ideas, guidance, advice as to how we can cope during this difficult time. And then we could not have had this conversation without the support of our tech people who are behind the scenes and, you know, doing everything and putting the polls and making sure that the things were queued up. So to Aika Washington and Vijay Saravanamatu, we really appreciate the support that you've given us, not just tonight. I know how much work has gone through this planning for this day, and so all the kind of emails back and forth, making sure everybody was on in that line. So we really do appreciate. Thank you very much. I wish you a restful and peaceful evening, rest of the evening, and take care of yourself and take care of each other. Thank you. Oh, one more thing. For people to access services, there is a lot of services out there. If you need food security, income assistance, housing support, mental health support, any kind of information, there has been funding for different communities. You can come to Taibu, but if you come to Taibu, we'll refer you to other places. But there is support out there, so please make sure to access those services that are readily available for the community, and tell other people. We have a hotline, call our hotline. We have a French and an English hotline. You can call and ask for information, ask for support. If we can't do it, we'll refer you to other people. It's time to get connected. It's time to support each other. So let's do that together as a community. My final thank you and goodbye right now.